meeting. First of all, thank you, Supervisor McGowan, for the quickness and efficiency of your last committee meeting. Thank you.
No one can hear you though, I don't think, Pete.
Yeah, Peter, please pull your mic a little closer.
I don't know which one is it.
Yes.
We're going to first start off with mental health, if we can, please. Rob, are you available?
Yes, I am.
Good. Thank you very much. I see one item as far as an action item on the agenda. That's a request for transfer of funds. Basically, can we maybe get a little explanation of what the request is for, and then we can put a motion on the floor to approve it. Rob.
Yes, thank you. The request for transfer of funds came up a little bit late, so I submitted an amended agenda. This is a request to transfer funds from the Glens Falls Hospital Behavioral Health Services to a new agency, Behavioral Health Services North. I think folks are probably familiar that Glens Falls Hospital is getting out of the business of some of their outpatient clinic services for mental health and substance abuse, and also a family support program that they run. And we identified a new agency, Behavioral Health Services North. It looks like that transition is going to occur sometime in November. And so we need to transfer funds this year out of the Glens Falls Hospital contract and into Behavioral Health Services North.
Good. Thank you, Rob. Can I get a motion to approve Mr. York's request? Motion made by Supervisor McGowan, seconded by Supervisor Frazier. All those in favor?
Aye.
Opposed? No, nobody opposed. Rob, we now get to your department budget for 2021. If you can maybe help us with that, we would appreciate it.
Yes, absolutely. So we have Harry Carlson, our Deputy Director Fiscal, also on the meeting today. And Harry put together our 2021 budget. And so I'm going to turn it over to Harry to walk the committee through.
Great. Thank you very much. Harry, you're on.
Okay, thank you. Can you hear me?
Yes, we can.
Okay. Zoom's not made for low talkers, I don't think. Yeah, we tried to keep the budget pretty much the same as last year, or for this year, I'm sorry, 2020 into 2021. There was a slight increase in the salaries, but that was related to one of our people that worked there are on contract. But the rest of the staff stayed as it is, and as you probably know. As far as the other than personal services, you know, we took out the $1,200 related to job-related courses, and there was a small decrease in the membership dues. Otherwise, it stayed pretty much the same. There's a 2% increase built in for the lease costs and the rental costs, so that bumped up a little bit. I think the biggest issue that we have this year, or we'll have in 2021, and actually this year also, is the loss, pretty much the loss of the district funds. And last year, in 2019, we got around $60,000 from this fund. This year, we've gotten maybe $4,300 right at the moment, and we really don't anticipate any more additional funds coming in for this from this fund. It was something that only lasted a few years, and I think we basically served us well for those years, but it looks like those days are over. I did figure in just a little bit of we got a reduction in our administration, that's figured in. Some was in this year and the other is going to be annualized till next year in 2021. But, you know, as far as the expenses go and the contracts, we pretty much held to whatever they're getting now. And we try to keep all our expenses as is from this year to next. Some it's just can't be, but so that's basically it. I mean, we tried to make it as easy as possible. But, you know, and I think, I'm not sure what documents you have. If you have any questions, you know.
Right. Thank you, Harry. Does any members of the committee have any questions for Harry? Seeing none. Any other supervisors have any questions? Seeing none. Very good. Well, listen, we thank you very much for your presentation. Is there anything else you want to add, Rob?
Nope, nothing else from our end.
Very good. Well, thank you very much, and you guys have a nice day.
Thank you.
Okay, thank you.
And we'll now jump to the Office of Aging. Dee, are you available?
Yes, I am.
Good. Thank you very much, Dee. First of all, the first item on the agenda is permission to fill the meal site cook number 2 position at the Indian Lake Motel site. Can I get a motion to get that on the floor?
I'll make a motion.
Ms. Frazier, seconded by Supervisor McGowan. Dee, if you'd be kind enough to explain the rationale.
Yes. We brought this to the committee back in March, and unfortunately, due to COVID and not finding a qualified, interested candidate, it lapsed the fill period. So we're going back to request to fill it again. We do have somebody that's interested that we will be offering to once it's approved.
Any questions as far as committee members? Supervisor McGowan.
Yes, are we still 3 days a week up there?
What's that?
Are we still working 3 days a week? I thought our Meals on Wheels and that were,
For the delivery, yes. The site is open 5 days a week. There's still no in-person meals, and we're delivering Monday, Wednesdays, and Fridays for every site right now.
is that going good? Are the people, are we giving double meals so they could, keep refrigerator or just temperatures and that? We're just serving 3 days a week.
They're getting a hot meal on Mondays, Wednesdays, and Fridays, and then they get a frozen meal on Mondays and Wednesdays to be used on Tuesdays and Thursdays. And it's been going very well, and we haven't really heard any complaints at all from any of the clients.
Is this something that maybe we could move forward? I mean, is there cost savings in doing this, or does it
There
really
is
volunteers that are bringing the meals?
This is actually on the last page of our budget information, where we are proposing to keep it, the deliveries at Monday, Wednesday, Fridays for 2021.
Okay, well, thank you, Dean.
Thank you very much. Any further questions as far as the committee is concerned? Seeing none, we have a motion on the floor in a second. All those in favor?
Aye.
Opposed? Carries. Request number 2, to amend the contract with Countryside Adult Home to increase the cost per meal to $3.85, include meals for Chestertown meal site and the increase not to exceed and increase the do not exceed amount to $115,000. Can I get a motion to get that on the floor?
I'll make that motion.
Supervisor Frazier, seconded by Supervisor Bruno. D. Rationale.
Currently, all the meals for the Warrensburg, Lake George area and Thurman are made at the Countryside Adult Home. The current cost per meal is $3.65 a meal. After doing an analysis, we decided that it should go up to $3.85 a meal due to the increased cost for food items and the supplies that we use. For 2021, we are also proposing to produce the Chestertown meal site meals out of that location as well. And then this would need to increase the do not exceed amount to $115,000 to accommodate both the increase in the Warrensburg site that we're seeing and the addition of the Chestertown meal site.
Any questions, comments? Supervisor McGowan.
Dee, I want to thank you for coming, and I wish my meal plan only went up 20% or 20 cents there since the pandemic has hit the price of food and everything, and I think that's a fair assessment of only 20 cents. I'm shocked it's that low, but thank you so much for keeping it down as low as we possibly can.
Any further comments or questions by any committee members? Seeing none, there's a motion on the floor in a second. All those in favor?
Aye.
Opposed?
no opposed. As far as your 2021 budget, Dee, can we maybe get some background and some justification for it, please?
Absolutely. So the first two sheets that you have in your packet is the Hamilton County budget summary, and then the next one is the Warren County budget summary. For Hamilton County, pretty much everything is staying about the same. There is some decreases with salaries and with fringe benefits, and that's the changes we've made to the positions for this year that'll carry over to next year. There is an increase in the 400s, and that is basically due to the increased cost of foods and supplies that we're seeing. For the Warren County budget summary sheet, again, you'll see a decrease for the personnel salaries and employee benefits. Equipment has stayed the same for contractual, the 400s. It has gone up a little bit, but that's to account for the increased number of meals that we're serving right now. It has increased due to COVID, and also the increased cost for the food items and the supplies. Just an example, a box of gloves for 10 boxes a case, instead of being around $20, it's now up to $100. So we did factor that in there a little bit to make sure that we have enough money to cover it. On to the budget worksheet report sheets. Page 1 basically goes over all of the Hamilton County expenses, their incomes, and what they contribute. Page 2 will go over the Warren County contributions and then the amounts that we get from NYSOFA, either through the state or the federal government. We have heard that they don't see any reduction in the funding amounts that we're going to be getting for next year, although we haven't gotten the official awards. On page 3, this goes over the actual expenses for Hamilton County. And again, pretty much everything is the same. You might see some transfers of monies within the 400s from one area to the next, depending on where it needs to come out of. Page 4 starts with the Warren County expenses, and then that continues on to page 5.
Thank you very much, Dee. Does any committee members have any comments or questions relative to Dee's budget? Any other supervisors? Supervisor Conover, yes. Supervisor Conover.
Thank you, Mr. Chairman. The move to 3 days a week on the delivered meals, the hot meals, is that, are you initiating that primarily as a savings matter, as a budget savings matter? What effectively is the you figure is the net savings to your department for that?
So if you look at the very last page in the packet that I gave to you guys, number 1 goes over that. The approximate savings is about $18,000 for the year. It's very hard to determine what our mileage is going to be because not everybody puts in for the mileage reimbursement. The primary reason for doing this is not for the savings, it's to maintain the safety protocols for COVID, and then also because we're seeing a reduction in the people that are willing to volunteer right now. So we figured it would be best to carry on with the Monday, Wednesday, Friday for 2021.
I see. Thank you.
Mm-hmm.
Any other questions? Seeing none. Thank you very much, Dee. We appreciate your efforts and your help, and have a good afternoon.
Wait, before you go, do you want me to go over the last 3 changes we're proposing?
Yes, please do. Yep.
Okay. So number 2, we're proposing making some changes within the Office of the Aging for itself, our office staff. We're proposing to delete our New York Connects coordinator position and create a services specialist position. This will be a savings of about $28,809. $28,809. And then to delete our supervisor of volunteers position and create a part-time aging services assistant. This would be an approximate savings of about $15,710 for the year. And the reason we're proposing this is New York Connects is 100% funded, but we're not required to have a position for the New York Connects coordinator, just the title. And this will allow us to use this 100% funding more across the board throughout the office. So that's the second change that we're proposing. Number 3, of course, is the relocation of the production of the meals for the Chestertown meal site. This will be an approximate savings about $24,816. And then the last one is to reduce the staffing at the Cedars meal site. We have one position that is currently vacant, and we're proposing not to fill it. And this would be an approximate savings of $36,643. So overall, if these 4 changes are, they go through the budget process, we would be saving an additional $123,978 county dollars out of our budget.
Good, thank you, Dee. Anything else, Dee?
That's it.
Okay, thank you, Dee. Any questions from any committee members, any supervisors? Seeing none, have a good day, Dee.
Hang on.
Okay, sure.
Yeah, I want to thank you for that, that last minute. I can't believe Supervisor McDermott didn't see that huge savings there. Yeah, but no, I want to thank you for all and how these changes will affect us in the future. And and really, the 3-day meal. It's not a huge thing, but as long as our constituents are getting some food and safely, and like I said with the frozen, I think that's a great idea. So thank you again for all the hard work.
Thank you.
Thank you very much. Moving on to our visiting nurses. Tawn Driscoll, are you? Oh, okay. Okay, guys.
You can sit at desk, I can hear you better.
Hey, guys. Very good. Do you want to start, Janelle, or is who's talking to start?
At least you get lunch.
So, hello, everybody. So the minutes have been approved. We only have one resolution request today. That's to transfer funds, and that's attachment 1. So I'll turn it over to Tom, and then she can go back into the expenditure report and a comparison report.
The transfer for this month is just moving salaries for temporary employee we just hired for 3 months. The position is in a full-time, so we just need to move the funds from full-time to part-time, and it's $11,800. I did not have to move any fringe because that would all still be the same.
Thank you, Tawn. Can I get a motion? Supervisor McGowan, seconded by Supervisor Conover. Any discussion? No discussion. All those in favor?
Aye.
Opposed? No one opposed.
Okay, attachment number 2 are our financials. To give you an idea of where we stand, we have not closed. We're just probably going to close August today. I just got notified that's done. And wanted to note our salaries again, that we're 54.93% of the budget, and last year at this time we were 66.09. This does include COVID, any salaries and part-time and overtime that's related, which has all been fully funded by grants. Our attachment number 3 is our comparison of last year at this time. And again, the salaries you see are contractual, which is primarily our preschool program. We're waiting still on being able to get some of those bills in and get them paid with the telemonitor and everything. It's been a little bit more difficult getting everyone to get the stuff in. We have had some parents to us because they do not want services that way. And our revenues also reflect that, because our preschool program, to date, the state has not allowed us to bill for this year yet for the preschool program, saying they were waiting to find out when they could pay us. So, I mean, I would think we could at least bill, but they're not even allowing us to bill. Yeah, I did just see something come through an email before I came up here, so maybe we got a notice we can do that now. So that's our status as of right now.
All right, moving on to attachment 3, it's our status of referrals. We actually have a positive number to report this time. If you look where we were July of 2019, we're up 4. And for the revisits, we are up 1 from where we're at. In all reality, we're picking up on our wound care businesses. At the time when COVID first started, people weren't really interested in having services or having people come into their homes. Obviously, we're still following a good number of people. All the elective surgeries were done, but our services are starting to pick up. Our nurses are very busy. So that report for you. And then also attached is our rabies and our emergency preparedness reports. So moving right along, I believe now we're to the privilege of the, or there are no pending items. And so moving to the privilege to the floor.
Supervisor McGowan.
Thank you, ladies and Janelle, really, I want to thank you for all you've done, and it's been such an honor following it. My question is, do you go home?
Yeah.
And then I see, and then I see Ryan's, updates coming in at 12:43 in the morning. I mean, it's just, they're worried about you guys. But also, Mike, so on the rabies, I always see that report. What are the majority of the rabies? Are they animals or are they dogs? Well, I mean,
Animals.
I mean, wild animals, I should have said, or are they dogs and cats? I mean, I just see these and I'm like, oh my God.
For the bites, the majority of them are domestic animals, cats and dogs. There might be a stray dog or cat. We have had some wild animal encounters as well. But definitely when we have on our bite system, those are dogs, and it's got delineated that cats, dogs, that kind of thing. We do have some others, like we've had a fox. If that's the case, that's under our post-exposure prophylaxis.
Well, I did read that we've had some things up north there. I think it was Bolton that, but I just, after so many years, everybody knows about rabies and I mean, like on the dogs and that, and I'm not trying to hold up, it's just, I'm curious. Is that because they haven't had the rabies shots? The owners haven't?
We also put in our report which ones are vaccinated and which ones aren't. Through public health law, we're obligated to follow up on all animal bites. We do a 10-day quarantine with the animals to make sure that they don't present with symptoms of rabies. As long as they're healthy at the end of 10 days, then we assume rabies was not transmitted. And if not, we assume we're following guidelines that if the dog is healthy at the end of 10 days, that it couldn't spread rabies at the time of the bite. So our office follows up on all those dog bite reports, but we also follow up on any type of exposures to wildlife. And if we have the animal available, we'll test the animal. If not, we have to authorize the rabies treatment. So we do that, and through COVID, we're still doing it.
That's why I asked if you go home, I just, but thank you.
You're welcome. So moving along, I was going to give just a brief COVID update because I know that you do get Ryan's updates in addition to, we have our budget. So with our COVID updates to date, we've done 714 mandatory quarantines. These are where we make phone calls and visits. Right now we have 56 that we're following that are active. Of this group, these would be people that are in mandatory isolation for 10 days for having a positive result. Or it would be somebody that was identified as a contact that would have that risk of coming down with COVID for 14 days that we quarantine for 14 days. Our precautionary list, to date, we've done 379. Those people receive phone calls every day. Usually those are people that have been able to work because they're essential worker status, which has to be screened and approved through our office and the employer. We make sure that screening is being done, that they're not reporting to work with a temperature or symptoms, and that when they're working, they're wearing a mask the whole time. Currently, we have 35 in that category. Like I said, to date, we've had 379. Travel quarantines, we follow up on. We get those referrals from a variety of sources. the state website, people sign up and register as travelers. We get the referral, we follow up. We've asked our hotels and resorts to report people that are from the states of concern to us. So we get those, we get the neighbors and friends and family that are upset that family members aren't quarantining. We get those calls. And to date, we've had 1,327. Currently, we have 100 travelers right now that we're following up in, and we do contact with them every day. We contact them initially to say, hi, you know, welcome to Warren County or welcome back to Warren County. Just want to let you know our name and our phone number so that if there's concerns or questions or you become symptomatic that you can call us. We're going to call you every day. Sometimes they might text us, but if we don't get the text, we then call. But we do make sure that they're asymptomatic every day so that we can quickly get them hooked into the service if they need that. Our cases, for a total, we have around 360. 26 of those are presumed, which was before we had testing. 334 lab confirmed as of yesterday. We have had at least one case reported to us today. So our numbers are not calculated because we do that at the end of the day. 117 of those have been at skilled nursing facilities, 13 in assisted living, and 193 in the community. Early on, you might remember when we were seeing all the activity in our skilled nursing facilities, that was over half of our cases at the time, and actually it was a good percentage of our cases, but now our community cases have exceeded what we've seen in our outbreaks in our nursing home. So just to kind of review that, 117 was our skilled nursing, 13 was assisted living, and so 193 are lab confirmed, so that's a significant number. Deaths to date, a horrible statistic to have to report out on, and I continually look at the sacrifice these families have done through the pandemic. Each one of those lives matters, but we've had 9 that passed away in a hospital, 22 in a skilled nursing facility, 2 in assisted living, and 2 at home. For the labs, I reported last month that we had over 10,000 people that have been tested. I did not get a chance to gather that number for today, but our clinic is up to 2,767. So it's a valuable resource to our communities that are using that, which is Warren, Washington, Saratoga, Essex, and Hamilton County. 57% of the people that utilize that are Warren County residents. We're seeing about a 95% negative rate, 5% positive rate. Of those 5%, 60 of those are Warren County positives. We've been working very closely with the schools. Last week, we worked with one school, and the week before we worked with another, but we get plenty of school calls every morning trying to help them vet who can go to school, who can't go to school, who needs to stay home, what kind of plans need to be in place, and then if there's exposures, what we need to do. That's working very well on a communication standpoint. We're able to get right to the superintendents. Superintendents are able to get right to us. They've got our cell numbers. They call us 24/7 when there's a concern. And I think because we're able to quickly get back to them, we're able to kind of help them out. I mean, their information, they need it now. They need to know at 7:30 in the morning if somebody can show up or not show up. You know, if they hear that there's a rumor that somebody's positive, they need to know, yes, it is a rumor, or no, it's not, and we need to do something. The schools, for the 2 investigations that we've done, have been incredibly cooperative, and I've got no complaints. And certainly there's always lessons learned, but it's not usually, we actually drilled it and talked about it and did all the what ifs before school started. So we're very happy with our school districts and the cooperation and the communication that we have with them. And I think I'm going to turn it back over to Tom for the budget, unless there's any questions about our normal stuff.
Maybe if I could just make a comment, Janelle, just maybe, there's clearly a very positive buzz occurring in sections of this county, and relative to the kind of work your group is doing in terms of the response to COVID. I know Bob Landry in the city of Glens Falls, who basically deals with the aged population at Cronin and Steckman Towers. And I believe he also has a facility in Hudson Falls, but he has spoken very highly about how responsive you have been and your organization has been. And I chatted with an elementary school teacher from Queensbury week or two ago, and we had a couple of children apparently at Queensbury Elementary School that I guess had COVID, but she just wanted to pass on how appreciative the staff at Queensbury Elementary School was in terms of your advice, your counsel, and just they just felt very comfortable in terms of what you're doing in your performance. So
Thank you.
thank you.
Any more questions? Okay, we'll get right into budget. Basically, I do the summary page, which is your top page of the go, color coded and everything, and that's a summary of all our departments. I won't go into necessarily all the detail, obviously, but the summary will give you an idea. I know all the highlights below that our WIC program, our bioterrorism program, and now we also have a new grant that we're asking, starting this year, going to go into next year. It's a 2-year grant for COVID. Those will all be fully funded, zero impact to the county. Also to note that our preventive program, within our preventive, which is Janelle and I and some other people, Janelle and our health director are considered mandatory positions. So those positions total dollars with fringe, $132,677. So I want to note that all the yellow you see in this area and the column that's all yellow, that's all the mandatory that our agency has. We have our preschool program, we have our early intervention program, and our disease program, and that totals $4,369,602. That the total loss on those is over 1.9, and it's 83.77% of our total bottom line impact is really these mandatories, but that's the way they are. Our payroll adjustments are the line that's kind of got the pinkish or peachish color. We have suggested to eliminate a nursing position in our home care, and that's salaries and benefits. And within our family health program, a person just left, and that position we're moving back over to CHA, and one of our CHA nurses we're moving over to family health. And that's actually giving us a savings right now of $7,222 because one person, the person that we're replacing, did not have health insurance. So that saved us there. The other thing, like I noted, our COVID ComCare, we call it, is our new grant. We've already set it up, as I said, with the treasurer's office. That's we're budgeting $150,000. We were given, we were told $261,379 for 2 years, up to over $1,261,379. So depends on what goes on with COVID. We budgeted some for this year, but for next year, we're going to estimate about $150,000 because that is a new grant and nothing is already with history there. That's something you don't see there. So you do see on that we are budgeting for a full-time nurse because with this program, with this grant, all the employees have to be newly hired just for that program. They cannot work anywhere else in public health, unfortunately. So our budget is to hire a full-time nurse to work with that program and also per diem people who are doing the tracing and all of that. And we anticipate those salaries to be $143,051. So it does look like our payroll will have an impact of $61,000, but that's not the case. When you back out the $143,000 in salaries that we're asking for, and then when we get to go put in the revenue of $150,000, as I said, the impact will be zero. So that will really give us a savings of $81,329 in salary. The same with the profit and loss that we're showing for 2021. It's showing $2.4 million. When you back out this COVID care, which will not impact the bottom line, it will get down to $2.3 million. Just some highlights. One thing is that our early intervention, just to remind you, is 49% reimbursement, and our preschool is 59.5% reimbursement we get from the state. We can bill insurances, some do pay. The only one in preschool we can bill is Medicaid, so we are trying to get that done. I did hear during budget meetings that our liability insurances, we were given the amounts, but we might see that go down. So that's something to think of. One big thing that hit us is Duran, who's our transportation for the preschool program. Of course, with everything in schools going back, I did budget. The most they can ask without us having to go back and ask and put out the bid is 5%. So I did include that in our budget. It was about an estimated $20,000 increase. Only come back and they now come up with some others. So we have had, I just checked before I came up here, we had only two families last year in a preschool program who transported their own children. And this year so far, we're trying to get them to do it. We've got 10 families. So that will save a lot of money. We won't have to put them on the bus. I understand the buses, that's going to increase because of everything they have to do. But at this point, we did budget that hopefully in the budget so we can anticipate that. One thing to note too is we get charged rent. Well, it's called maintenance in lieu of rent. And the rent this year for both our agency and the WIC program went up 13.65%. Average over the last, I went back to 2016, average is probably around 2% of an increase. So this was a big impact to all of us that hit the bottom line too. That's all I have. Unless you have any questions. That's a summary of, and you can see too, I put out there what we put out there for 2020 current budget and where we actually came in last year. One thing we got hit with at the end of last year, just to let you know, was our preschool program. For the preschool program, you can go back up to 3 times to ask for more money if you can verify that. And in December, we got hit with a lot. And so that's reflected in 2019. That was over $250,000 or more, maybe it was $280,000. Went back to 16, 17 at least, I know. So that's why you see that impact, unfortunately, in 2019. And like I said, so far revenues for this year for the preschool program, there's barely anything because the state has a lot. But as soon as we can, we will.
Thank you, Tom. Any comments, questions? One more time, Supervisor McGowan.
Thank you. Ron, I remember that discussion and I was just so dumbfounded that New York State can go back 3 years and decide, oh, wait, we didn't charge you enough.
3 times. It can be more than 3 years. Like we went back to 16 and went back, some we've had back to 14, 15. Yeah, it's more than.
It just baffled me. And now, it's well, we're going to cut you 20%. And now, we don't even know if we're getting our fair share of sales tax money because, there's no way to do checks and balances. I am just, and you guys you got to pull this out of the air. Thank you. And I appreciate that. I just wanted to be heard out there that you can't make this up.
And it is difficult because you have to go back. I got to thank IT and Jeremy. He built this program years ago for the preschool program so that we can go in, change the amount. Now, if it went from 24,000 to 25,000, and then it will adjust it and help us. And we tie that out to what we're billed, and it makes it easier. I'm not saying it's easy, but it does help. But yeah, unfortunately, they have done that.
Well, thank you.
Very fine. Don Lehman, is there anything out there?
No, Chairman McDevitt, not at this point. Nothing on YouTube.
Thank you, Don. I appreciate it. Any further comments, questions, observations? Seeing none, can I get a motion to adjourn? Supervisor McGowan, seconded by Supervisor Fraser. All those in favor?
Aye.